This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Welcome to another edition of Behind the Headlines. Today I'm joined by David Atkinson as my co-host. We're filling in for Charlie Greenwald, who's on assignment. And today we're joined by Ann Womble, who's the Executive Director of the Lancaster Dollars for Higher Learning. And welcome, Ann.
Thank you.
And thank you for being here. And if you could fill us in on the good works that you're doing, for students wanting to gain a better education.
Sure. Well, Lancaster Dollars for Higher Learning has been an organization operating in Lancaster County since 1961. We provide interest-free loans to any student in Lancaster County graduating from a high school or a home school, even a private school, who plan to attend an accredited institution of higher learning full-time. And we provide these interest-free loans every year, and a student may apply for one loan or two loans or for up to 4 loans. And they do have to reapply every year. And our loan repayment terms at the end are very generous, because once a student graduates from college or from trade school or technical school, they have a 6-month grace period before they have to begin repaying. And our program has been so successful in Lancaster County, we've probably issued well over 10,000 loans in all of the time that we have been operating, because our donors also appreciate the fact that their donations, their contributions to our organization, will continue to recycle back into the community generation after generation. And so it's not like a scholarship program where the money goes out the door today and then we have to just start replenishing our funds. They know and we know that those funds will eventually come back to us in the form of loan repayments. And it's been a wonderful way for community citizens to serve other community citizens without the government being involved at all. And we hope that because our program's so successful, that it would appeal to other people throughout the state of Pennsylvania, other communities, and maybe they'd like to start a similar program.
One of the distinguishing things about Lancaster County is that students are coming from a lot of different places. We have the public school districts, we have religious schools, we have private schools. We have a vibrant homeschooling community there in Lancaster County. So are the students coming out of these various programs all eligible to participate in this?
Yes, everyone's eligible, and as I say, they can be going to any college. They don't have to be going to college in Pennsylvania. It can be any college throughout the United States, even Canada. And we just ask that they keep a tie to Lancaster County and remember us over the years, even after their loans are repaid. So we do appeal to those students who have chosen to live elsewhere, even beyond college. But our loans are available to all students in Lancaster County who plan to attend an institution of higher learning full-time after graduation, and they're even available to adult students who will be going full-time as well.
Well, that's very important, for all our views across the state, that, they can do this too,
Right.
in their county.
Right.
Because I presume that really helps people with that pre-planning, to know that they're going to be helped out in some way.
Right.
And what percentage of the tuition is usually covered, by these loans that then they'll repay after graduation with
Right.
no interest?
Well, it certainly depends on the institution that the student is attending. As you know, the cost of higher education has gotten so burdensome, really, and we hear all the time in the news about the crisis, really, of the student loan program, the government student loan program in the nation. I would say if a student is attending a community college or a trade school, our loans, which are in the amount of $1,700 each this year, and we have 600 of them available. If a student's going to that type of school, maybe this would cover a quarter of the tuition. We do pay our loan payments directly to the school, so it doesn't go to the student personally. So it does go right against their tuition bill. But if a student's attending a private high-end, liberal arts college, private, anywhere in the country, that those tuition bills now can run $50,000 or $60,000 a year. So maybe our $1,700 doesn't affect that kind of a bill that much. However, a lot of the families that receive our loans are kind of in that, what I call the squeeze. They're not poor enough, if you will, to receive, a full ride scholarship based on need, but they're not wealthy enough to just simply pay for it out of pocket. And so many people are caught in that vast middle. And so that's where we feel that our loans help to fill that gap. And students are still encouraged, of course, to find all the scholarship and grant opportunities that they can. A lot of times their colleges are offering them a financial aid package. But ours, we are very proud of the fact that our default rate over time has been less than 1%. And what we hear so often back from the parents and the students after they graduate is they actually prioritize paying our loans back first. And that may be counterintuitive. You would think that they would start to pay their interest-bearing loans first. But they're so grateful for the fact that our program is interest-free. We try to work with students. We keep it a very personalized type of program. And if there's a difficulty, we try to work with that. And so all the time we receive thank you notes through the mail. Your loans made all the difference. It helped me to afford that stretch school that I might not have been able to go to.
As you have gained experience as you've described, and as your track record for the repayment is so outstanding, is that helping with the fundraising? Is that broadening your community support? So, in other words, success builds upon success.
Right, absolutely. And one of my jobs in my role as executive director is to continue to tell our story. We like to think of ourselves really not just as a loan-making organization. That's sort of boring to say. We really want to say that we are advocates for higher education. And we believe that all students should be encouraged to understand that they're going to need some type of credential beyond high school. If they're not cut out for a traditional college or not interested in that type of education, certainly they should be looking at a trade or occupational or technical school, and our loans are available for that. And that's another thing that our donors are very impressed with, that we're not trying to be exclusive in any way in terms of making a judgment about a certain type of education beyond high school. But we do have that requirement that a student is going full-time. And the reason for that is that we feel that that is just that much more of a commitment to finish that certificate or degree. And we want to really be a hand up, as you hear, a hand up and not a hand out. So
very, very exciting. And I'm sure the viewers are excited about this too. The community leaders, those involved in higher education, the colleges. Pennsylvania is well known for higher education, all different levels, all throughout the state. So if they want to join with you, with this program, to understand how this works, maybe you can tell our viewers, what your website is, and how they can get in touch with you.
Absolutely. Our website is www.lankdollars. That's LANCDOLLARS.org. And we actually we're very proud of our website. We redid it to about a year and a half ago, and students apply right online for our loans, and so it's very user friendly, but it also is descriptive of the program itself. And if any other communities throughout the state are interested in replicating it, they can find a lot of information there. But I encourage them to just call me. Call us at the office. I'd be happy to talk to anyone. As I say, I'm just proud to be associated with this organization so much, because I'm proud that it's not a nameless, faceless government program, and that we can provide personalized service to students in our community. And I know folks throughout the state and the Commonwealth that want to help students in their communities would like to have a program similar to this, because they can see the results, see the fruits of their donations and their efforts.
One of the things that we've seen a lot of discussion about is the debt load problem. And it is not just the young students, but increasingly we see that the problem is people who've mid-career lost a job, or people who've had a family breakup, or whatever the reason, and they decide that they're going to pursue higher education. So is this available to older returning students as well?
Absolutely, it is available, and the difference is simply that younger students, the traditional students, if you will, we do require a cosigner on our loan agreements, and these are enforceable loans. It's not a so-called honor loan. For adult learners, we don't require a cosigner, so maybe that's a benefit. I'm not sure, but again, it's available to anyone going full-time to an accredited type of school, and trade, occupational, technical school, community college, four-year college, graduate school.
And have you been getting a lot of buy-in by the colleges and other schools in your county? And would you suggest that people are interested in that? That's where they should sort of get started. The community leaders that want to do this by contacting the institutions of higher education in their individual counties?
Well, it just so happens that the #1 recipient of our loans happens to be Millersville University, which is right in Lancaster County, and I'm proud to say that too because I'm a trustee at Millersville University, so I want to plug Millersville. But we have a nice partnership there. Of course, many local students are going to Millersville, and one of the executives one of the administrators at Millersville happens to sit on our board. So we do try to tie in a lot of links to the leaders of the local colleges.
And Charlie, being a professor,
that's right,
alum
Charlie
would say, "Bless you."
Yes,
Absolutely.
right, definitely. Well, thank you very much, Ann, for bringing us up to date and showcasing all the good works that you and your other board members have done for the rest of the state. And we'll have to have you back to see how you made out this year.
Right.
And thank you very much for informing us, and we'll be right back.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
We're pleased today to welcome Andy Carter, who's the president of the Hospital and Health System Association. And we're going to be looking into many interesting points today. And Andy, welcome. And
Absolutely.
Can you fill us in on the Affordable Care Act and how it's gone over these last years as they're now thinking about changing it, and give us your opinion on how it has been functioning?
Well, first, thanks for having me, Jerry. And yes, the Affordable Care Act, in the view of the hospital community, has done a tremendous job improving the healthcare delivery system. A couple of ways that we see it here in Pennsylvania is that we've seen a 40% reduction in the number of people who do not have insurance. And that's a huge benefit to the way healthcare gets delivered. The historical pattern was that lots of people who don't have insurance would go to hospitals for care at the last minute in an emergency, and there would be pretty poor follow-up care. So with now 1.1 million people enjoying coverage as a result of the Affordable Care Act, we've just seen a huge reduction in the number of people uninsured. We've seen a 10% reduction in uncompensated care to hospitals. That's been great for healthcare.
So the problem is, if they just repeal the CARE Act and they don't have a successor plan ready to go, do we then revert to the bad old days?
Pretty much. It's hard to imagine a world in which you do just a plain old repeal and hold on to all the gains that we're really proud of. Such gains as the fact that children can remain on their parents' policy until they're 26. the fact that insurance companies cannot exclude people who have pre-existing conditions. Those are just a couple of examples. And we'd have to return to a day in which people don't have insurance and they show up at hospitals without an insurance card. We will take good care of them, but it will not be the kind of rational healthcare system we ought to have. And we'll see a huge financial strain for the healthcare delivery system. We could imagine, like right now, in order to help pay for the coverage expansion, we gave up billions of dollars in healthcare payments in exchange for the revenue we would see from expanded coverage. Well, if that coverage goes away, we're going to have those resources put back into play, because we can't continue to deliver this care if we absorb $15 billion in cuts over the next 10 years, which is what we would be doing if there's a repeal with no replace.
How would that affect Pennsylvania as compared to the other 49 states? Are we at more risk?
We are. That's a terrific question, Jerry. Pennsylvania was one of the states that it chose to expand Medicaid. Both Governor Corbett had a plan for expansion. That plan was replaced by one put forward by Governor Wolf. So we were early in committing to expansion. And that's led to over 700,000 people having coverage. And so we would, for those states that did expand, a full-blown repeal without any kind of replace would be relatively more devastating for us than it would be for a state that didn't get around to expanding.
Andy, I think a lot of the viewers maybe don't fully appreciate the role of hospitals in the economy and the employment picture in Pennsylvania. And I know several months ago you put out your latest compilation of statistics. What kind of story did that tell, and what does that mean for the future to Commonwealth?
Well, you know, we like to recognize that the number one job of the hospitals in our state is to provide top quality health care. Incidental to that, provide services to 12.7 million Pennsylvanians. It takes a lot of people. Directly and indirectly, hospitals employ on the order of 600,000 people. We contribute to the economy over $100 billion in economic activity. So when it comes to maintaining a good, healthy economy in Pennsylvania, we need to keep people healthy so that they can get to work and be productive. And we need to shore up these engines of economic growth. In many communities, the biggest employer is the local hospital. And we would hate to see a situation in which a repeal of the Affordable Care Act would force hospitals to pursue such cost containment strategies as layoffs. This would be the worst time for that to happen. But they may not have any choice, as it is. Take, for example, hospitals in our rural communities. 30% of them are already operating in the red. They're barely making it. So any kind of disruption to the coverage that we have in place could easily be catastrophic. And it's not just an urban situation. People think that hospitals are counting on Medicaid expansion to support health care only in urban communities. The fact is that Medicaid expansion and the marketplace have helped something approaching 300,000 to 400,000 people in our rural communities enjoy health care coverage for the first time. So again, it would not just harm our urban centers, it would also harm our rural communities. And I like to remind myself that something on the order of 27% of Pennsylvanians live in designated rural communities. So we have to be mindful of that as well.
And I know we're going to have to adapt in Pennsylvania, because this is a federal issue, with Congress, addressing this. And I believe everyone is talking about the fact it's just not going to be an outright repeal. It's going to be a repeal and replace, or something called that. What would you suggest, to our congressional delegation that they should be looking to, that would be different than, say, one of the other states? In Pennsylvania, do you have a list of things that you've told our congressmen, make sure this is included, that we're a little bit different than other states?
Sure.
What are some of those issues?
Well, we really want to try to replicate to the degree we can, however Congress chooses to do it. We want to replicate the level of coverage. So we already have 1.1 million more people covered thanks to the Affordable Care Act. So however they want to go about it, if they, for example, adopt health savings accounts with some refundable tax credits as an alternative way to get the job done, they simply have to make sure that those credits are sufficient to make the coverage they would buy affordable. So that's key, and in Pennsylvania, affordability will be a huge priority for us. Second, we have to make sure that any kind of replacement strategy ensures that there are still sufficient resources flowing into the delivery system so that we can maintain the quality of care and services we've been providing. And third, we've asked them, because Pennsylvania is a major leader in accelerating quality improvement in healthcare, thanks in part to some resources that the Affordable Care Act has put into Pennsylvania, $10 million over the next 3 years, for example, to help us work with hospitals to help them improve the quality of care. For example, to reduce the rates of infection that still unfortunately happen in hospitals. We need those resources to keep that work going. And it's money that's generating a very good return on investment. We've reduced some of these infections by over 30%. And we just got to stay on that track.
One of the brave new worlds of healthcare is telemedicine. And I'm guessing that the infrastructure to accomplish that is not cheap. So as we're talking about all the money involved with the Affordable Care Act and what might happen to funding if there's a repeal effort, how does that tie into the efforts to expand telemedicine?
Well, one of the misunderstood values of the Affordable Care Act is that it's actually putting a lot of pressure on healthcare to be more efficient and effective in getting the job done. And serving rural Pennsylvanians, to be good at doing that cost effectively, we need strategies like telehealth, where we can connect a specialist in stroke care in one part of the state to a patient who's just suffered a stroke in a rural part of the state. And we can do that. We have the technology, but to your point, David, it is expensive. And in Pennsylvania, there is no requirement that insurance companies have to cover the cost of that telehealth, telemedicine consult. And that's a problem because the infrastructure is expensive, and we want to develop alternatives for people who live in rural communities besides having access right there in their community directly, face-to-face, with a stroke specialist. That's unaffordable in every community. Telehealth is a very cost-effective way to get all of us access to the world's best specialists. But if insurance companies aren't willing to pay for it, we've got a huge problem.
And with the licensure issue, with telemedicine, has that been settled now? And the same thing as like with portability we didn't used to have, and we worried about this certification before. Has all that been smoothed out by the healthcare industry?
Licensure issues are resolved on a technical side, but we don't face what I would consider regulatory and licensure barriers as much as we do the payment barriers. We have to get that fixed.
Okay. I'd like to switch gears, to the state level, also, which is real important. Besides, you're going to be taken care of, and our legislature going to be taking care of the Affordable Care Act, but then also with Medicaid and also with other health care issues here. With this new session, with the new budget, what are some of those legislative issues that you're looking to for our General Assembly and for Governor Wolf?
Well, budget is job one. We were pleased that the governor, for the first time in his administration, has submitted a budget that did not cut hospitals. We think that was an important vote of confidence in the work we're doing. Beyond the budget, we do want to support legislation that creates a level playing field and a level paying field for telehealth. That's a very high priority. We also want to pursue and support legislation that allows advanced practice nurses to operate at the full extent of their training and licensure without the requirement that they be overseen by a physician. That's a priority as well. And certainly we are eager to get the legislature to tackle some of the tough issues around tort reform. I know in talking to you, David, and others, it's been a long-standing issue in Pennsylvania. It's time to get the job done to ensure that we're not promoting a practice of defensive medicine because of too many frivolous lawsuits. We have to take steps to ensure, for example, that emergency department physicians and nurses who are operating obviously in a crisis situation aren't held to the same standards as other medical professionals in different environments. The unique environment of an emergency department warrants different standards when it comes to medical liability. we hope to be able to fix that soon too.
Andy, it's always struck me that one of the things that make hospitals different from a lot of other institutions is that in the current climate where people want accountability, where they want to be informed as to the strengths and weaknesses of institutions, you have the reports that come out regularly from the Pennsylvania Healthcare Cost Containment Council, and that provides a level of information and presumably accountability that a lot of other institutions can't point to say, here's what we're doing right, here's what we're doing wrong, here's what we got to do to fix this.
We adamantly support as much transparency in the healthcare delivery system as we can possibly provide. And we've done a few things to promote that. One is we have our members taking pledges to do everything they can to make it easier to understand financial obligations that they face when they get care. We have a new website portal on our own website that allows Pennsylvanians to go and compare hospitals on quality and price. We urge patients to be well educated and well informed every time they go to visit a nurse or doctor. We have to make sure that people feel empowered to manage their own health care and to take responsibility for it. And for them to do that, we have to make access to information easier for them. So we're underway on that front, and nothing has been better for the quality of health care than all this transparency. We got to be careful that we don't have so many measures and scorecards out there that it's overwhelming, but there's a lot we can do to help people figure out, do I want to go to hospital A or B for this particular treatment?
Thank you so much for better informing all of our viewers across the Commonwealth. It's been very, very informative. Thank you very much.
Thanks for having me.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.